It's really, really dark time for me. They're real people, they have real rents to pay, some of them have families.
It's been the hardest week of our lives.
If you do find you're sort of stuck in a rut, reach out for help.
So what on earth is coming next?
I think we're doing an incredible job.
He's weighing in the balance, stock market against dead bodies.
Tonight, on a special live 60 Minutes.
Just shows how powerful and infectious this virus is.
The battle to keep our health system going.
This is a disaster. I'm scared about it.
And the unthinkable.
Could have stopped the spread by 95%.
How China could have stopped this catastrophe.
5 million people left Wuhan, spreading the epidemic with them.
Before it started.
The worst cover-up in human history.
I'm Liz Hayes.
I'm Tara Brown.
I'm Liam Bartlett.
I'm Sarah Abo.
I'm Tom Steinfort, and this is 60 Minutes. Good evening and welcome to a special live edition of the program. Tonight, the Prime Minister has announced Australians are facing even greater restrictions on movement. Public gatherings of more than 2 people are now banned. There's also strong advice people over 70 should immediately self-isolate. After an already tough week, about the only certainty in our lives now is we must brace for worse to come. Coronavirus is an emergency unlike any we have ever seen. This catastrophe is growing and no one is immune. It's hard to imagine a more spectacular location to celebrate a wedding than Stanwell Tops, an hour's drive south of Sydney. Only 3 weeks ago, 100 people were invited to watch Jimmy Maggs and Emma Metcalf get married at the beautiful, exclusive Tumbling Waters Retreat. No one at this celebration could have suspected that a guest who'd flown in from America would arrive here with a wedding crasher like no other. That one person walked in with COVID-19. Unwittingly, 39 people left here with the coronavirus. That is just how contagious this disease is. It's an airtight window. We're all happy for Sal to take the mask off so we can hear her properly. Yep. Sally Hawach was one of those infected guests.
Hi.
This is weird, isn't it?
This is very strange. This is a first for me.
Making it worse, Sally is nearly 8 months pregnant with her 3rd child. That wedding, it's unbelievable how many people got sick there.
It really is. I'm surprised that so many people were infected in such a short period of time. It was really only a small group of people at the wedding. So again, that just shows, you know, how powerful and infectious this virus is and how seriously we all need to take it.
Describe for us when you were at your worst, what the symptoms were.
When I was at my worst, I had shortness of breath. I was actually struggling to breathe.
I mean, when you're struggling to breathe, a doctor says to you, you've got coronavirus. I mean, does, you know, for want of a better term, I mean, does your life flash before your eyes?
I was worried about my kids more than anything. I was worried about the baby in my tummy, and I won't know for sure until I do an ultrasound, but no one will see me whilst I have the virus because they don't want me near the maternity ward, obviously.
Hi, so tonight might be our last night before we have our first positive negative.
Sally spent the last 2 weeks in quarantine with her husband and baby girl, who also became infected. She's the daughter of legendary businessman John Singleton. But for Sally, it's the forced separation from her uninfected son that's been the worst.
The hardest part that I'm struggling with right now is being away from my son. I'm missing him terribly. I can't speak with him because he just cries and he doesn't understand why he can't see me.
Just a week ago, Sally was one of the rare, unlucky coronavirus cases in Australia. But by the end of this coming week, projections forecast there will be around 15,000 Australians infected with COVID-19. This is a 1 in 100 year war. And our health system is the front line.
Through your voice box, Marty, so you might have a bit more coughing.
Everyone knows someone bracing for impact. For me, it's my brother Daniel and his wife Emma. Both are doctors at Royal Melbourne Hospital, which leaves me proud, but also worried. Emergency doctor, respiratory doctor, you're kind of in the eye of the storm of this, both of you, aren't you?
Yeah, we kind of realised that a little bit into it. At one point when it was going on, we thought, hold on, this is us, this is lungs, this is emergency. And clearly it's bigger than that, but it did occur to us that we're really both in a role that's right at the front line, I guess.
Are you worried for him?
Yeah. But I think that this is what Em does and what she does well, and I think that she'll be the right person to be at the front line.
You worried for Dan?
Yeah, I don't want Dan to get sick. I just don't. That'll be hard. When this door closes, that door opens, and you're only going in there when you're in full personal protective equipment.
But the reality is that despite all the protective equipment and precautions, some doctors and nurses will get sick. In Europe, more than 10,000 medical professionals have now been infected with coronavirus while treating patients.
It's a hard thing to face for me, just knowing that I might be exposed to something that, I'm aware that can cause severe life-threatening disease even in young people. And there's going to be, unfortunately, death. And that's really confronting.
Are you scared for how bad this could get?
Absolutely. This is a disaster. We're going to see huge amounts of sick people coming every day to hospital and all needing care. And I'm scared about it, yeah.
And then I need it doing.
Daniel and Emma have 4 young kids at home.
GT every day.
Juggling work and home life means time is never on their side. Are we 2 arms apart here? But they believe when it comes to coronavirus, social distance, Australia is lucky to have been able to see this disaster unfold overseas first, so our hospitals have time to prepare.
Overseas, they were hit pretty, they were hit a bit blind, and I think we've got a lot of people, I haven't seen coordination like this within a hospital, between hospitals, including with government bodies, that there's a very coordinated response, I think, which puts us in a pretty good position and certainly makes me feel better.
I'm just gonna keep praying to God that it's not my time yet. Because I got things to do. I got things to do.
Tara Langdon is one of the thousands of coronavirus patients in Europe to end up in ICU. And one of the lucky ones who's lived to tell the tale.
Oh my God, I wouldn't wish it on my worst enemy, let alone an elderly person or a child, because it's like you have glass in your lungs. Every breath is like you have glass and, you have no breath. You literally think you're going to die, or my thoughts were, okay, I'm going to need oxygen for the rest of my life.
It is so horrible.
Videos Tara took in her hospital bed ended up being shared to millions of people, with many surprised that someone so young could be hit so hard.
Be able to breathe.
Tell us a bit about you before the virus struck. Were you healthy? Were you active?
Yeah, I'm a mum of 2. I work hard. I'm always at the gym. I live a healthy, active lifestyle. So that was my life before I got sick.
Were you thinking, I'm in my 30s, I'm healthy, this isn't something that's going to affect me?
Yeah, totally. And also, I think as well with something like a virus, I know it's a crazy thing to say, but it's invisible. You can't see it. So it's almost like, you know, it doesn't exist. And I was quite blasé about it, yeah.
Are you glad to have Mummy home?
Tara is back home and her health is slowly returning. But there are now global concerns that up to 20% of coronavirus survivors may suffer lifelong complications. You've studied the first wave of patients that have been discharged from COVID-19. From what you've been looking at, what's been the most surprising finding so far?
I think the lung function is one of the most surprising findings because this is obviously a lung disease. But according to the past experience from SARS, we did see some patients, around 10% to 20% of the patients may have their lung capacity affected in terms of the so-called restriction. The lung becomes stiff and difficult to breathe. So,
Dr. Owen Sangyak Tin is the medical director of Hong Kong's Infectious Diseases Centre. Notably, he also believes that the more you weigh, the higher your risk when it comes to COVID-19.
Yeah, obesity is one of the risk factors. The obesity is one of the risk factors for deteriorations after the infections. And we also have 2 patients are now in ICU because they have significant obesity. So obesity is one of them.
So you're saying if you do get coronavirus and you're obese, that's bad news?
Yeah. Yes.
There's so many unknowns still. Really, coronavirus in itself is such an unknown. So there's still a few more checkpoints to pass before I can be completely hooray out of here.
One of those unknowns is what impact, if any, the virus has had on Sally Hawatch's unborn child. But late this week, some good news. She was told she's no longer contagious and finally allowed to see her son again. This reunion was a rare ray of sunshine at such a grim time in our history. Because after weeks of watching the coronavirus tsunami hit hospitals overseas, this week it feels like those waves will really start hitting Australian shores. What do you think Australians need to know about coronavirus?
Oh my God, the same thing that the Brits need to know, the same thing that every country needs to know. So I would say to people who are thinking of just being blasé, the way that my mindset was at the beginning, it's like, take it more seriously. Because if you get it and you get it bad, it will be one of the most traumatic experiences of your life if you survive it.
Coming up, our special coverage of the coronavirus crisis continues.
Welcome back to our special live edition of 60 Minutes. Let's get the very latest medical developments now in our fight against coronavirus. I'm joined by the Deputy Chief Medical Officer, Dr. Nick Coatsworth in Canberra. Doctor, good evening to you. Look, we're going to start off with some glimmers of good news here because today, for the first time, the rate of infection has actually slowed. Are we beginning to flatten the curve?
Well, Tom, thanks for having me on this evening. They are encouraging signs, but it is early in the piece. We've only just introduced some of the more stringent quarantine and isolation measures. And so we'll observe closely as the health advisors to government exactly what happens in the coming days.
Where do you see us perhaps in a week's time in terms of where these numbers of infections are headed?
So I think the important thing really is to know that every day brings a new set of numbers. And whilst we've seen encouraging numbers today, we're going to have to look at how things develop on a day-by-day basis. But I'll tell you what we're preparing for. We do not want to see situations in Australian hospitals like we have in Italy and the United States. And it is exceptionally difficult for our staff in hospitals at the moment. I speak to them every day when they see those images. But we're preparing for a 200% increase in intensive care bed capacity across the nation. And we're working every day to make sure we've got sufficient ventilators and support materials so that we can care for patients if the worst does come to worst.
Well, it's interesting you touch on ICU beds because the Medical Journal of Australia is suggesting that all of the ICU beds in Australia will be full with corona patients at their guess between April 5 and April 8. It's not very far away. Do you see that as a realistic estimate? And secondly, you touched there on the fact that there are more ICU beds coming. Is that at existing hospitals or are you expanding to other locations now as well?
So I'll address the first question, which is the Medical Journal of Australia article. Now that's only, 5 or 6 days away that we're supposed to completely saturate our intensive cares. We have, in usual business, just over 2,000 intensive care beds in Australia. And today we have, unfortunately, 48 patients who are in intensive care with COVID-19, and I wish them and their families all the best in their recovery. But we can already expand our intensive care capacity to over 4,000, and we're looking at taking it again to around about 7,500 beds. So these preparations have not started yesterday. Obviously, we've seen the images out of the US and Italy for the past 4 weeks, and for that period of time, all our intensive care units around the country have been preparing for this.
So you're confident that there won't be an issue of bed shortages in the coming weeks?
I'm confident, Tom, but I don't want to see us get there. And whilst we can have our doctors and nurses preparing for this, our state health departments of the Commonwealth preparing for this, what we actually need is for every single Australian to beat the virus, remembering that I've said often that the virus has only got one move. It's got to get from one person to another. So if we don't want to get to anywhere near like Italy, and I don't want to see anywhere near the strain that the Italian health system is under, then we actually have to, as individuals, practice that distancing from people and all the measures that the government has been asking us to do for the past several weeks.
There's so much comprehensive data on this issue, and it's interesting to see that the areas that have the highest rates of infection are actually in our most affluent suburbs. Are the people there ignoring the health warnings, and do you think that for some reason they might believe they're immune?
No, I don't think so. I think all Australians really do get this. I was down at one of the lines in Access Canberra the other day, only 4 days ago, and everybody was keeping 1.5, 2 metres distance between themselves in the line without any encouragement at all. So I actually think that most Australians understand the gravity of the situation now. It's been expressed from everyone, from the Prime Minister through to ourselves, through to healthcare professionals. So no, I do think people get it, and I'm not sure why that's happened in Australia's affluent suburbs. I know there are clusters across the socio-economic spectrum, and so no one in this society is going to be immune to coronavirus.
In terms of social distancing measures, when do you think we will start to see whether or not they have worked? Is it a 2-week proposition from when those measures came into place to when we'll actually know they've been a success?
Yes, it's effectively a 2-week proposition because that's the outside maximum of how long it would take an individual to display symptoms. But I think one important thing to remember is that it's been almost on a daily basis that new distancing measures have been introduced, most recently and most stringently the quarantining of returning travellers in hotels. So whilst it's not going to be just from today, we should be able to start seeing some effect of those measures within the next 7 to 10 days.
And just finally, on a bit of a personal note here, I mean, you're a father of 3. Do you, in your own time, worry about what could happen to your own immediate and extended families?
Yeah, I do. That's been occupying my mind for a long time now, and I think I've said in the media before that my mother's got emphysema, so she's really at risk from COVID-19. And, every healthcare worker that you see, every Australian has parents and family that could be affected by this. So what I've tried to do is just keep them at home. We only go out if we absolutely need to. My daughter was Skyping a good friend of hers yesterday, and they're loving the novelty, but every parent knows that that's going to wear off soon, and this is going to be really challenging over the coming weeks.
Well, Doctor, we definitely salute the work you're doing at the moment. It's so important for our whole country, and we appreciate your time with us here on the program this evening.
Thank you, Tom.
Coming up, more of our special coverage.
Self-isolation and social distancing are terms few of us would ever have thought about a few weeks ago. Now, though, we seem to discuss them in just about every conversation. We've all had to make enormous adjustments to our lives, and for many, the impacts of that are overwhelming. Earlier today, the federal government announced it was pumping a further $1 billion into programs aimed at safeguarding our mental health. Sarah Abo looks at how Australians are coping.
Empty chairs, empty tables, empty kitchens, empty classrooms. This week, the fear of catching coronavirus was joined by another emotion, a great sadness, a terrible sense of loss.
I wish I could say something that could take that pain away.
Restaurants shut, businesses closed down.
Yes, I feel there was a big emptiness. It's probably one of the darkest days of my life.
Millions of jobs lost, students sent home to learn remotely.
I think everyone was a little bit anxious at first. Hi, Miss Clark. A little anxious about the whole situation.
Suddenly, everything was silent.
The real danger at home is loneliness. It's a risk because anxiety, as you know, has been growing.
Chef and restaurateur Nino Zuccali is lucky if he gets 4 hours sleep a night. The rest of the time is spent trying to make sense of this unprecedented new world where he literally can't open his 2 Sydney restaurants, Pendolino and La Rosa.
Joe, how you going, mate? Yeah, it's bad. Most businesses can sort of shelter themselves for a while, or can deal with a catastrophic event like this for a while, but how long is it going to go on for, you know?
So nothing could have prepared you for this?
I think most people would be on belief. You know, it's lethal, like, you know, it's really, really lethal. I'm really, really regretful and really sorry that it's actually happened this way.
Like thousands of other small business employers, it's been hit after hit for Nino. But the worst of it was when he had to call a meeting and let go of 80 staff members.
All the restaurants in Australia closing.
What's it been like for you to sit down with your staff and give them such bleak news?
Well, it's really terrible.
It'll be a matter of time before.
But she loses her job too. You know, it's an awful scenario. It's nobody's happy about it. It's sort of, I feel like I'm throwing them off a cliff, you know. But at the same time, I'm free falling off a cliff myself. And we're just trying to find places for our guys at the moment. Everyone's been stood down.
Nino predicts if this goes on for 6 months, he'll plunge into devastating debt. The only thing that keeps him going now are the moving messages from his devoted customers.
We've had an enormous amount of heartfelt support for us from some very, very long-term clients.
Has it been heartening to receive that support from the public?
Yeah, I can't read some of the emails because
It's just too hard.
Sorry.
No, don't be sorry.
Yeah.
You've poured everything into this. This is, I mean, this is your baby.
Yeah. Oh. Yeah.
And there's obviously a lot of people out there who appreciate you and what you do.
There is a lot of support for us, and the things that people have said have just been really amazing, so.
What does it look like when you're confronted with this bleak new reality?
Oh, it's just a black feeling, you know. It's a really black feeling. It's very, very low.
Huge pressures. So many people are just finding it heartbreaking to have to give very tough messages to people who have worked alongside them in businesses, large and small, for years and years.
It was on my mind 24/7, just wearing me out.
As chair of mental health awareness organisation Beyond Blue,
I will not be lectured about sexism and misogyny by this man.
Our former Prime Minister Julia Gillard is reaching out to Nino and everyone else going through incredibly tough times.
Don't blame yourself would be a really principal message. People would feel that burden on their shoulders, but You know, at the end of the day, the individual business owner did not cause this pandemic.
Because 1 minute life was normal and the very next everything had changed.
Yeah, it's the suddenness, isn't it, is part of what I think is snowballing people's sense of insecurity. And when so much has changed so quickly, it's understandable that people are anxious about, and what's going to happen next, and what's going to happen next. That's the world we're living in.
Please welcome former Prime Minister Julia Gillard.
Julia Gillard has been in self-isolation after returning from overseas a week ago, where she came into contact with the Canadian Prime Minister's wife, who later tested positive for COVID-19. Back here in Australia, she knows there are millions hurting because Beyond Blue's support service is getting swamped.
We've actually seen levels already that are greater than what we experienced during the bushfires. It's just telling you a fair bit about how anxious people are. If you're at home and you're kind of climbing the walls, remember staying at home is about saving people's lives. And for most people in the community, you don't get to say every day that I'm doing something to save someone's life.
Is there a risk that we are going to turn inwards to find ourselves in a dark place, you know, within four walls?
I am really worried about that. You can get into self-talk where you're sort of catastrophising. You're imagining the worst future. So you're saying to yourself something like, what if family members died? What if all of my family died? What if I died? You know, if that is happening, then it's very important to kind of situate yourself back in the present. People would call that mindfulness, and then try and think about the positive things the future could offer. But if you do find you're sort of stuck in a rut, it's getting dark, you're living with a lot of anxiety, reach out for help.
I'm concerned about the staff getting worn out. Staff at the moment are working jolly hard. They're emotionally tired.
These vacant classrooms at Presbyterian Ladies College, Sydney, define today's reality. Before the pandemic hit, a school with no students and only a principal in it wouldn't have made any sense.
I was talking to a teacher last Friday when we'd already decided to go online, and we were heading out to the new world of online learning, and she was almost grieving at that point.
But Principal Dr. Paul Burgess believes, despite the grief, there's still hope for his teachers and 1,400 students.
We're really encouraging the teachers to do funny things, to make it quirky, to make it fun, so that when you're at home you feel connected. We've got to look after student wellbeing before we look after anything else.
What's it like for you when you walk around the corridors, the grounds, the classrooms, and they're empty?
It's eerie. We miss them. We miss them very dearly.
No, you don't see them as much. I mean...
No, but we see them on the screen. There they are. They're TV stars now, so they're okay.
Has everybody listened to my video?
The virtual classroom now looks like this. In their own homes, students connect with their teachers online. One after the other, they join the chat, ready to learn in a thoroughly modern way. It's something Angie Raphael is actually enjoying.
This is quite an unconventional classroom though, isn't it?
Oh yes, yeah. Home is very different to what it would be in class, but different isn't always bad.
Could you ever have imagined that you'd end up here, learning from a computer?
Where I don't think anyone could have really guessed that this would be happening a few weeks ago. I think it was shocking because it wasn't something that we were used to, and it was something that was so new.
Already, it seems the entire Raphael household is adapting. Dad Tony is working from home to supervise his 3 children, while Mum Lydia is on the front line. As a respiratory specialist, her expertise is in demand more than ever.
And I guess you're one of the reasons the government wants schools to remain open. You're on the front line, you're a healthcare worker.
Look, it's a double-edged sword because if you keep the schools open, then the kids' education will continue, but there's a chance of infection that they might bring home. There's a chance of infection that I might bring home, and then that goes to the school. So at least now I'm comforted that they're in good hands and that they're continuing to learn and to grow.
But there's a toll on everyone, even Principal Dr. Burgess.
It must be a challenge for you, for your colleagues, when you become educated so that you can nurture our future generations and help them become the leaders of the future. And now you're not even seeing them, really. They're not in the classrooms.
Look, I cried when my father died, and I cried last Saturday morning. You know, I didn't mean to do this.
No, that's totally fine.
You know.
Why has it been so hard for you?
Oh, look, it's been fantastic. It's just been exhausting.
Nino Zoccali's restaurants were his lifeblood and his passion. But now it's simply about staying afloat. So he's selling all the restaurant's wine in an updated online store. And his famous pasta is now being transformed into a grocery item.
So basically, overnight, you've had to change your whole business model.
Completely, you know, it's just survival at the moment.
As a former Prime Minister, Julia Gillard has some understanding of what makes Australians tick. And so even in these uncertain times, she has faith we will overcome this virus battle. If you were to sit down and address the nation, advise them on dealing with depression and anxiety, what would you say?
Well, my days of formally addressing the nation are over. That baton's been passed along. But if I was going to try and put it in a couple of sentences, I would say, we'll get through this, we'll get through it together, we'll get through it by working together to save lives. This is temporary, there will be the other side. But right now, let's just do what we're being asked to do, keep people safe.
Coming up, more of our special coverage of the coronavirus crisis.
Not only is COVID-19 set to become the worst pandemic in modern history, it could also be the biggest cover-up the world has ever seen. The culprit, China. More and more evidence is emerging about the early days of the outbreak and how senior leadership of the Chinese regime, including President Xi Jinping, deliberately downplayed the virus and willfully suppressed vital information about it. As Tara Brown reports, the damning allegation is this is a global catastrophe that could have been stopped before it started.
Wuhan, China, a sprawling city of 11 million people. It was here that coronavirus, our invisible, brutal enemy, was born, festering at least a month and a half before the world was told.
I don't think there's any dispute at all in terms of the scientific record that this virus made its original jump to the first human sometime in mid-November of last year.
Emerging diseases expert Laurie Garrett has been eyewitness to more than 30 frightening disease outbreaks, including Ebola and SARS. Like most New Yorkers, she's now restricted to her apartment in Manhattan, sheltering from coronavirus.
That's about 12.5 million human beings. So we're a little bit bigger than Wuhan. And I feel like that's what I'm looking at, America's Wuhan.
The epicenter of the coronavirus in the States at the moment.
I don't know if you hear it right now, but I hear 4 sirens right now outside. These are all ambulances. There goes another one.
Wuhan, mid-November, and first cases of a strange new flu start surfacing. From early December, Chinese authorities say the new virus has arisen from a local live fish and animal market. They're adamant it's not SARS or anything like it. Anyone who suggests otherwise is suppressed. On New Year's Eve, an official announcement. The closure of the wet market has stopped the spread of the disease, and there is no evidence of human-to-human infection of the virus. But as you'll see, that was not true.
from the very beginning, throughout December, it was spreading, and we now know it was spreading human to human. But the official line of the Chinese government was that this was all related to an animal market, and once they closed the market, it would all go away.
Did they know differently at that time?
Absolutely. Because they were seeing cases coming into the hospitals that had nothing whatsoever to do with that animal market.
A group of senior doctors at Wuhan Central Hospital was becoming more and more terrified by the cases they were seeing. Chief amongst them was Dr. Li Wenliang, the whistleblower who first tried to warn the world.
I'm sure history will record Li Wenliang as the hero of this entire pandemic. He recognized that he was seeing people with a bizarre form of pneumonia. He got into a chat room and said, "I think this looks SARS-like." So he posted this. That triggered every alarm in the system. So all 8 of the physicians, including Li Wenliang, were brought before the equivalent of a hospital tribunal and compelled to sign statements declaring themselves liars and that rumor mongers. And they were officially chastised, but they continued working, treating patients. And of course, we all know Li Wenliang died as a result of COVID at the age of 34.
They are responsible for one of the worst global pandemics ever known to mankind. And it's happening right now, and it's destroying people. It's destroying lives, and it's destroying our economy.
US Congressman Michael McCall is the most senior Republican on the Foreign Affairs Committee and is former chairman of Homeland Security. He accuses China of deliberately hiding the truth.
Well, I've described it previously as the worst cover-up in human history. I think it was criminal, what they did.
But this isn't just a war between the US and China. Congressman McCall points to a respected independent newspaper based in Beijing, which uncovered shocking behaviour by Chinese government officials. It reported that testing labs that had cracked the code and identified the mystery flu as a new coronavirus strain were ordered to hand over or destroy their samples. They were not allowed to release their findings. When they're getting laboratories to actually destroy samples, I mean, the culpability of that is mind-boggling, isn't it?
It is. The Chinese Communist Party perpetrating this, going in, destroying samples, trying to cover this up. And the fact that 95% of this could have been stopped had we taken it seriously at the beginning and the World Health Organization been properly notified, that they just could have contained and stopped this from happening.
But that chance was lost over a 2-week period. On January 7, a week after they identified the flu as a new coronavirus strain, Chinese officials informed the World Health Organization. But they advised that with just over 40 cases, they had it in hand and that it couldn't be transmitted from person to person.
We believe that they can also contain it.
The truth is, the epidemic was doubling in size weekly, and China knew it was being spread by human contact. It's just the rest of the world was kept in the dark.
Inside Wuhan, the people knew what was going on. Everybody was seeing the bodies being pulled out of apartments and the ailing just completely out of it on gurneys, being carried off to mysterious hospitals all over the place.
From January 7, the next 12 days are critical as China's Great Lie continues alongside its inaction. Had China acted immediately instead of covering up, it's estimated that 95% of the eventual pandemic could have been prevented, but it didn't. It's not until January 20 that China reveals the real rate of infection. Instead of a total 40 cases, they're now reporting more than 400 a day. And they finally admit what they've hidden for weeks. The deadly virus is contagious between humans.
By then, catastrophe is looming, and January 25 is the official lunar holiday, the biggest holiday in all of China, arguably the single biggest holiday on earth, because more human beings move about within China in anticipation of the lunar holiday than any other occasion of internal movement anywhere in the world.
During January, President Xi Jinping was well aware of how deadly the situation was. Yet he made a decision that would ultimately condemn the world. He allowed 5 million people to leave the epicentre of the virus, to leave Wuhan without being screened for COVID-19, before he decided to impose a lockdown.
By the time they finally do that, we have a catastrophe on our hands. It's already spread to Singapore, to South Korea, to Japan. We're in the beginnings of the pandemic.
As China now tries to rewrite history and claim it was transparent all along, a final nail in the coffin of their lie. Just 2 weeks ago, the head of emergency at Wuhan Central Hospital, Dr. Ai Fen, also went public, saying authorities had stopped her and her colleagues from warning the world. She has now disappeared, whereabouts unknown. How squarely do you put the blame at the feet of that regime?
I'm arguing that this entire pandemic rests at the feet of two people, Xi Jinping and Donald Trump, the two most powerful men on earth, of the two most powerful and wealthy nations on earth, both of whom sought in their own ways to downplay the significance of the emergence of COVID-19. And really, both of them, I think, are to blame for allowing this to unfold in this horrible form.
China has been working very hard to contain the coronavirus. The United States greatly appreciates their efforts and transparency. It will all work out well, in particular on behalf of the American people. I want to thank President Xi.
Incredibly, Donald Trump's gratitude and glowing endorsement of President Xi Jinping came after his own intelligence agencies had warned him China wasn't being open about an impending global outbreak of the virus.
We have it totally under control. It's one person coming in from China, and we have it under control. It's going to be just fine.
Well, I've been working on this problem of emerging pandemics and epidemic threats almost my whole adult life.
Or is everything just Ebola?
And of course, I was one of the 3 scientific advisors for the movie Contagion. We really spent a lot of time thinking this through. And yet, now that it's really here, this is so far beyond what anybody ever imagined. I mean, we never imagined the entire world economy collapsing.
What did they die of, the 3?
Reports are vague. Seizures, comas.
We've reached out to the WHO, see what they know.
So in your imaginings, is your government responding the way you imagined it would? Is it responding the way it should?
I'm sorry. We made a big mistake with that movie because we never imagined an incompetent American government. So in all of our plotting, government was actually the hero. It was intervening to save the people. And that's just not the way it's worked out. We've now had the president say openly on more than one occasion that he's weighing in the balance the future of the stock market against dead bodies in this country.
For Donald Trump not to take this more seriously sooner, what is the cost to your nation and your people?
Well, I think it caught some by surprise, how quickly it spread and how fast it did. But scientists have been looking at this for quite some time. And I think that I don't blame the president. I blame, the Chinese Communist Party for this. And I know the president's been briefed on this. I can tell in his latest briefings, you can tell him getting more and more agitated with China because he's realizing now the ramifications of what they did.
Laurie Garrett says the whole world will be ravaged by COVID-19. And so her prediction, sobering and dire, extends to Australia.
what you're experiencing right now is not really the major assault on Australia. That will come with July and August. So when you go into your winter, that's when COVID will really hit you.
So even the actions we're taking now, where we're in virtual lockdown, we're still going to get hit. We can't avoid it.
I don't think so. I think you're taking reasonable steps now, but you've not really had the brunt end of this, and that's yet to come.
What makes this so awful is that this could have been avoided.
Absolutely. And China knows it, which is why they're working so hard to create a different narrative that doesn't put the blame on Beijing.
More of our special coverage of the coronavirus crisis in a moment.
Around the world, Italy and Spain continue to record terrifying numbers of dead each day. But now it's the United States and New York in particular, where the infection rate of coronavirus is really soaring. The great concern is COVID-19 might have mutated into a more deadly form, one that's attacking younger people with no pre-existing medical conditions. As Tara Brown reports, frontline medical staff in New York warn this could be another grim turning point in these darkest of days.
New York is America's first battleground in the war against COVID-19. The infection rate of the virus here has been more ferocious than anywhere in the world so far.
This is different. This is bigger. This is worse. This is young, sick people. This is high volumes of people.
The city is in shock. Makeshift morgues are being built.
I'm an ICU doctor, and I don't really scare that easily, but this is scary.
And more, the stories of the dead include the young and the seemingly healthy.
We had a couple, a husband and a wife that both passed away. Lots of devastating, horrible stories of people whose whole families are taken out. They were at a party together, and the three people in the same family have passed away. So 100 devastating stories that I could tell you.
Dr. Mangala Narasimhan is head of intensive care at 6 major hospitals in New York. The death toll here is 700 plus and counting. Over 50,000 cases, with hospital admissions increasing by an incredible 40% every day.
Understanding that a lot of people that we saw today probably won't make it through this.
Can you please describe to me the scenes that confront you as you walk through the doors of the hospitals you work at the moment?
Just the sheer numbers of extremely sick people. We have numbers of people on ventilators that we normally would never see. And the challenge is just the volume. And they're not simple patients. They're very sick and require a lot of care.
Do you have the equipment you need? Do you have the personnel you need?
So our numbers are basically doubling every 3 days. We've been able to keep up with it so far. The challenge is that once they go on the ventilators, they stay on for a very, very long time. At some point, there will be an issue with having enough of everything, the way things are going right now in New York.
How soon do you expect that to be?
Our prediction is 2 or 3 weeks if we keep at this rate.
But there are already shortages at another New York hospital. This is the emergency ward at Elmhurst Hospital in Queens, as its director, Dr. Colleen Smith, pleads for more ventilators.
Today is kind of getting worse and worse. We are right now scrambling to try to get a few additional ventilators or even CPAP machines. If we could get CPAP machines, we could free up ventilators for patients who need them.
Outside, a truck. Now the hospital's makeshift morgue.
We had to get a refrigerated truck to store the bodies of patients who are dying.
Leaders
in various offices, from the president to the head of health and hospitals, saying things like, we're going to be fine, everything's fine. And from our perspective, everything is not fine.
Everyone in my group is actually stunned at how hard this is and how we take care of very sick patients all the time, but not like this, not this number.
But perhaps the most disturbing, most terrifying aspect of this New York outbreak is the age and health of its victims. Tell me about your patients. You know, what type of people are presenting with these symptoms? Who is being targeted by this virus?
So that's a very good question. I think there's a misperception out there that this is targeting older people with a lot of medical problems. That is not what we are seeing in our hospitals. Our hospitals have an average age of 60, and I have many 20, 30, 40-year-olds, many of them, very, very sick on ventilators with no medical problems. So the majority of them are younger people with a few or no medical problems. So the misperception of this can't hurt me because I'm young, I think, is a dangerous one.
Is it a misperception, or are you actually experiencing something different to many parts of the world?
I don't know the answer to that. I can only say what I'm seeing. The patients that we have that are younger are the ones that are getting better with time, but not all of them. Many of them have not made it. So I don't know the answer. I don't know if this is a different strain that's more virulent and with younger people, or if it's just the population that it's hitting. I don't know the answer to that question.
We are watching COVID-19's unstoppable advance across the world. The desperate battles being waged in hospitals from Italy to New York. A war that is only just beginning in Australia.
And if this goes on for a month or 2 or 3 or 5 like it did in China, and we're already this strained, we don't have what we need. I don't really care if I get in trouble for speaking to the media. I want people to know that this is bad. People are dying. We don't have the tools that we need in the emergency department and in the hospital to take care of them. And it's really hard.
As you face each day going into work, do you ever feel overwhelmed?
Yes, all the time. I feel like I wish this would end. I wish it would slow down. I worry every day about ventilators and supplies. My colleagues do the same. Everybody's tired, and I'm hoping that we see a slowdown soon. Every day I'm worried.
Hello, I'm Sarah Abo. Thanks for watching. To keep up with the latest from 60 Minutes Australia, make sure you subscribe to our channel. You can also download the 9Now app for full episodes and other exclusive 60 Minutes content.